Hello, I'm Dr. Laukkanen, and thanks for joining me as I discuss why one might consider radiation after having a part of the breast removed and finding a small invasive breast cancer that hasn't spread. The main idea is that the combination of a lumpectomy and breast radiation gives exactly the same result as if a person had a mastectomy. And if we look at the alternative of just removing the lump without having any other treatment like radiation, there's a reasonable chance that the cancer will come back in the breast. Our goal is to lower that chance as low as possible. So even if the visible cancer is gone with a lumpectomy, there could be microscopic bits of cancer hiding in the breast. And over time, it could grow until it became visible on a mammogram or felt as a lump. And so what we see is a mastectomy is a better treatment than a lumpectomy by itself because some cancers do in fact grow back. And it turns out that those microscopic bits that can over time become a detectable cancer are often near where the original obvious cancer was. Not always, but often. And if one were to send a high energy radiation beam through the breast, for many types of breast cancer cell, that high energy radiation beam can cause the cells not to grow. And so what we've learned is that radiation is often successful. There's no 100%, but often successful in getting rid of small deposits of breast cancer. And so the combination of a lumpectomy and radiation gives the same outcomes as a mastectomy. And there have been a large number of studies over this last 20 or 30 years showing that. And from the patient's point of view, while there are the surgical choices of a mastectomy and a lumpectomy, the lumpectomy surgery is an experience that is both quicker, more straightforward, and from a patient quality of life point of view, often preferred over a mastectomy. A person always has the choice to have a mastectomy, and work has been done, especially in the last 25 years, on reconstructions as an alternative choice. And there are some situations where it, in fact, is a very good choice. So individual preferences are important in deciding, but the key is that lumpectomy and radiation is better than lumpectomy by itself and as good as, in fact, sometimes better than the whole breast removal. So two other things we think about these days are partial breast radiation and no breast radiation at all. And what has been learned is that in some cases, it's possible just to treat an area around where the cancer was removed. And also in people over the age of 65 to 70 that have cancers with what we call highly favorable features, that if they take pills that are based on these positive hormone receptors, that they can potentially forego radiation. So just to summarize, radiation has a place because it can get rid of microscopic cancer cells in the breast, and it does so without causing too much bother to the normal tissues. And so radiation treatment after a lumpectomy is what we would call the standard of care for most people that have localized breast cancers, and especially those that are under age 65 to 70. And thanks very much for your attention.